I love that you used the terminology disruption in this new book of yours. And anyone that knows me, follows any of my social media, you see that I use healthcare disruptor quite a bit in there too. And so I love that terminology. I love what it means, and that you've put that in the title of your new book, The Great Healthcare Disruption. So let's jump into that. Why now, and what inspired you to do this book at this time right now?
Well, Forbes, it's a book that's a Forbes book, called me up about a little over a year ago and said, "You want to do a book on health?" I said, "Sure, I'd love to." I said, "What about health?" They said, "Whatever you want to write about." And I said, "Well," and then we had several conversations, but ultimately at the time, I said, "There's a lot of change going on in healthcare, a lot of new entrants into healthcare. We have problems. We don't have enough primary care. We don't have enough preventive care. On the one hand, on the other hand, we have all these new technologies." And they said, write about all of that. And so I did, got a lot of input, learned a lot. But at the end of the day, I wouldn't have ever uh, thought that healthcare would be changing so dramatically as it is today, due to all kinds of forces. But fortunately, almost all these topics that are germane today are part of the book. And it's, as you may or may not know, it comes out next week, May 6th. It's already available for pre-order on Amazon, but it'll be in bookstores everywhere. And I hope that people will take a chance to read it because it's a nonpartisan, totally unpolitical view from somebody who, as Tim said, has been in healthcare basically my whole life. And I want people to think about it, ask questions. And again, privileged to be here to talk to you about it today.